Next is we're going to ask for the ear. First step is that we should always check the orders of the doctor. It is a vital part of our job as a nurse, and with this we can give a proper assessment for the patient. So first, we should check the or assemble the equipment. So we are going to use the otoscope, this one. Next, this watch with the second. So it's here. Next is for the our tuning fork. Okay. So next is we're going to uh, identify the patient. So the patient is beside me right now. Hello sir. Do you remember me again?
Yes.
Okay. So what's my name?
Your name is Ken Sanglitan.
Okay. Good. So Mr. Deposa, we're going to assess for your hearing. Or assessing the ears of your left and right side. So what I'm going to do is that after obtaining the result, we should proceed to the nursing intervention so that we could give the proper healthcare and health services for you. Before and after the procedure, we should always wash our hands. So washing our hands prevents the spreading of the contamination or microorganisms from one place to another. We will be closing the window for confidentiality. Is, we should determine the client's history or present health concern, which as follows. First is that the recent changes in the hearing, the any ear drainage. We should describe the amount of the color, or if there's any. Next is any ear pain. We could use the cold spa in to explore the symptoms. So next is any ringing or crackling in the ears. Lastly, patient experiencing like a spinning or the room is spinning or the dizziness or in the imbalance. So with this, this identifies any related symptoms or risk factors which the presence of diseases involving the ears. Okay, so after that, we should position our client in a comfortable seated position if possible. This is to promote good and proper body mechanics. This is we're going to first is external ear structures. We're going to inspect for the auricle tragus and the lobule and note its size, the shape, and the position. We should observe any lesions or discoloration and discharges. So with this, we should note the shape and the position of which could after that continue inspecting the auricle tragus and the jobule or after that observe for any lesions and discolorations and discharges. So normal findings are ears are equal in size, so and it's bilateral and the auricle aligns with the corner of each eye and within a 10-degree and angle so of the vertical position. So earlobes may be free, so or it's attached or soldered. So the skin should be smooth with no lesions and lumps or any nodules. So color is should be consistent with its facial. Is we're going to palpate the auricle and the mastoid process of the patient's ear. So start now. Okay, so um for Mr. Deposa, can you come closer? So I'm going to expect the auricle tragus in your ear. Okay, so on the left other side. Okay, so I can see that the color, the size is equal. It is bilateral. Um, the auricle aligns with the corner of each eyes. So I can observe that within a 10-degree angle of the vertical position, the earlobes may be it is attached. And also I can sense that the skin is smooth on our ear. So I see that there's no any sense of lesions and or any lumps. Okay, so there's no lumps, so I can see that it's normal. The color is consistent with this facial, so there's no light dark color. There's no signs of any discolorations. Then as I can observe, it's normal. We are going to palpate the auricle and mustard process of the patient. Here I'm palpitating now. Okay, so on the other side. Mhm. So for its normal findings, they are the normal oracle. I'm going to explain the normal findings. So the oracle and tragus and the mustard process are it's not tender. So this is a sign of normal. Normal. There's no abnormalities in your um, oracle, tragus, and the mustard process. So I think it's good that there's no sign of any abnormalities. After the external ear structure, we're going to check for the internal ear using the otoscopic examination. So first that we should inspect the external auditory canal of the patient. With this, I should inspect any discharges along with the color and consistency of the cerumen. And I should observe the color and consistency of the ear canals and inspect the character of any nodules or earwax. So by using the otoscope. So for the positioning of the how we should hold the otoscope, it should be like this. So right now I'm going to check for the patient's internal ear. So okay, I'm going to check now. Okay. So with this, I'm trying to detect if there are any discharges or any discoloration and the internal part of the patient's ear. So the normal findings for this, if there's a small amount of any odorless cerumen, or we should say this as, or also called as the earwax of our ears, is the only discharge. So that means it is normally present. Then cerumen color may be yellow. It should be yellow or orange, red or brown or gray or black. So consistency needs to be soft, moist, dry, flaky, or even hard. So the canal walls should be pink and smooth without nodules. So that will be our normal findings, and while inspecting for the external auditory canal and the internal ear. For our next test, again using the otoscope, I'm going to inspect the tympanic membrane, or also called as the our eardrums of our ear. So we should I should always take note for the color, the shape, and the consistency, and its landmark. Start for the tympanic membrane now. Okay. 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 So I see that there are the normal findings. Again, there's no um, there's no any discoloration. The consistency of the shape and it's normal, and the landmarks is good. So I see no problem, and I see that it is normal. No any signs of any abnormalities. So, good evening, Ma'am Leila. So right now we are going to perform the whisper test. So I will explain the procedure of the patient. So sir, good evening. What we are going to do is that you will rub your tragus of your ear. So it should be right here, okay, on each side of your ears. So after that, I'm going to whisper a word with two syllables only. So you try to guess it 6 times. Okay. So are you ready, sir? Okay. So right now we are going to start for the whisper test. So you can start rubbing your tragus part, and I'm going to whisper a word. Okay.
Baseball.
Okay. I'm going to go to the other side. Okay. If I start rubbing.
Apple.
Okay. So with that, right now I'm going to just let the patient guess for one word. But in reality, in actual scenario, the patient should guess it.
6 words.
It should the patient should guess 6 words with 2 syllables. So if the patient gets 4 or 5 or 6, then the patient's hearing is good. If you can only guess 1, 2, or 3 words with 2 syllables, then we can say that it is not normal. Then there should be any alteration to assessment for the patient. Okay. So good evening again, ma'am. Supposed to be after finding out that the result of the whisper test is normal, we should not supposed to do the Weber's test. But for the sake of the return demo, and so that I can show you how to do it properly. So we are now going to do the Weber's test regarding of the result from the first test. So let's just imagine that the hearing of the patient has been diminished. So that will be all. With the hearing test, we're going to put it first in the perpendicular canal, and the next is the for our B is the mastoid process. We are now going to produce a sound residing at the perpendicular area down to the mastoid process. So, ting. Okay, so may I ask you, can you still hear the audible sound if I move the fork?
Yes.
Okay, so I see that's good. So as you can see, while producing the sound for the patient, I can see that it's normal since you can hear the resonating sound which I produces while moving it to the mastered process. So I can observe that it is normal. There is no abnormal findings which the patient has an unpleasant sound or any inconvenience while hearing the resonating sound. So good evening, ma'am. The last test is the Romberg test. So again, here's my patient, Joseph Reposa. So we are going to perform the Romberg test by letting the patient stand firmly. Okay, as you can see here, both of his hands sidewards. This, okay, that's good. So with this test, as what I've remembered from your lesson, we can tell if the patient doesn't have the sense of hearing. Then if the patient doesn't have the sense of hearing, then the patient cannot balance. So that's how the Romberg's test works. So we're going to start the assessment now. Are you ready? Okay. So we are going to start now. So for the first assessment, Mr. De Deposa, you can open your eyes. Okay, for a few seconds. Okay, you can close it now. Okay, so you can open it now. So as we can observe, there is no signs of any unbalance with the patient like this, in closing the eyes or opening the eyes. So the patient he stands firmly, and there's no sign of shakiness. So that basically means that his hearing is good. He has the sense of hearing, which connects with its balance. So for the evaluating of the document, we are done. Thank you very much. So for the documentation, we should write it as a result, and we can proceed for nursing
For legal purposes.
and for the legal purposes. So that will be all. Thank you.
Pwede ba?
Okay, so for documenting, we should always write our result or what we have observed from the assessment. So as this is for the legal purposes, and so that we can proceed for our nursing care process, and we could accomplish the task properly and give the proper health care service. That will be all, ma'am. Thank you very much for listening, and have a good day.